This video, I'm going to talk about decongestants and why I don't recommend them much anymore. I think many people have noticed that children under 2, we no longer give them decongestants. And the reason is we've noticed that it caused seizures and rapid heart rates, but also they got ill for longer periods of time according to the research. So from after that research was done over the last several years, we no longer give decongestants to children under 2 years old because it led to worse outcomes for a cold. And as you know, everyone gets a cold once or twice a year, and it's caused by a virus, and antibiotics don't work for them. And a lot of people ask for decongestants. But just like the children 2 years and younger, I don't use it for adults either, unless very extenuating circumstances. And the reason is, for the very same reasons as the kids, it can cause rapid heartbeat, it can cause blood pressure to rise. I've actually had a few patients that had strokes and heart attacks after taking decongestants after their blood pressure shot up. So there are certain medicines that don't have that, but there's still other reasons why not to use decongestants. Namely, mucus buildup. God invented us to have mucus buildup for a reason, and the scientific reason is mucus is a natural antibiotic. So if you stop the flow of mucus by taking a decongestant, you dry up the areas and temporarily you feel better. But more importantly, you dry up that natural mucus that would usually allow you to get rid of the virus a lot faster. So I advise my patients not to use decongestants unless absolutely necessary. And absolutely necessary is where they're so miserable that they have to use it to have some sense of relief. But once you use that decongestant and that mucus dries up, you've taken away the natural antibiotic that would prevent you from getting a sinus infection after a bad cold. So once again, colds are just viruses that would go away if you let the viruses shed, and the mucus is your body's natural way of helping it shed. But once you stop that mucus flow with the decongestant, you stop that natural antibiotic. And then on top of that, if you do require an antibiotic, if everything's dry, your body has no ability to get that antibiotic into that space because the mucus helps deliver that antibiotic because there's very poor blood flow in your sinuses. So once again, I rarely use decongestants anymore because I don't want that natural antibiotic to stop, and I don't want that virus to be there longer to cause a worse infection in the long run. So if there are any other questions, of course, talk to your own medical provider or see me in the office if you're my patient, and we'll talk about this further. But this helps answer the question why I don't use them. Now, I use Mucinex. That's not a decongestant. That thins out the mucus and helps the mucus keep flowing but come out faster. I also still use Robitussin. But anything with ephedrine, pseudoephedrine, anything with a D at the end, like Allegra D, Claritin D, Zyrtec D, I really don't use them much anymore because I want my patients to get better faster. Even though they might be a little bit more miserable temporarily with all that mucus is what's helping them heal up faster. Thanks again for watching Dr. Art CMC, and be ready for the next video.